It is not uncommon for people to have extreme anxiety at different points in the disease process. You know, it depends a little bit on your history. You know, if you come in and you have had issues with anxiety or depression or mood disorders in the past, you know, obviously we're going to pay attention to that as a care team. But first and foremost is to make sure that you're talking about it with your care team. You know, acknowledging that anxiety is a perfectly normal part of this disease process. Depression can be a very normal part of this disease process. But those are symptoms just like weakness, just like speech difficulties. And that's how we talk about them. You know, it doesn't mean that you're weak or unable to adjust or any of those negative qualities. It just means that this is another symptom that we have to deal with. Now, depending on the approach that you want to take, you know, some people need pharmaceutical intervention. You know, medications can be very helpful, particularly in the beginning, if you're having issues with sleep, if the anxiety is causing racing thoughts so that you can't do anything else. If you're tearful all the time and can't engage in any happiness or joyful things that you would normally engage in, you know, those are red flags for us. And that is part of kind of a holistic approach to care that, you know, we think is so important. That, you know, we can tune your body all day long, but if your mind isn't in a good place, it's not going to make as much difference. So, you know, seeing a therapist or a counselor, you know, we'll recommend that oftentimes. Can be very helpful. Mindfulness-based therapy, which, you know, we find very effective for most of our patients, is sort of changing your mental mindset. How you look at things every day. It does take practice. Sometimes it requires a combination of the two, you know, engagement with a therapist and pharmaceutical intervention. And it may be that it ebbs and flows, which is very common too. You know, you might need it to get you over the hump initially, and then you groove along and you do okay, but then something might happen that kind of throws you off kilter, and we need to go back to the drawing board with it. You know, it's a moving target, just like any of the other symptoms of the disease.